Yeah. Good evening, all. Actually, I'm a pediatrician. My main interest lies in treating pediatric cases, and I observed over years that there is a lot of scope for preventive healthcare among pediatrics. Like we all know about non-communicable diseases in adults, like hypertension, diabetes, can be controlled by a lot of. There's a lot of preventive scope in those diseases, and for same pediatric also we have. If we change the quality of, if we change the dietetic habits and the pollution and infectious disease also can be controlled in a aspect. This would definitely society in terms of financial life risk or mortality and also morbidity. So today the health cost is huge, and government hospitals are overburdened. So they are not left with low socioeconomic status are not left with any other option except approaching private hospitals. So that is the reason healthcare burden has increased. And 2 years ago, there was an article that 55 million people below poverty line were further pushed. 55 million were pushed below poverty line due to healthcare expenses. So that is the reason I was always looking into where all we can have a scope of preventive healthcare among pediatrics. So this topic of climate change and health burden also stops also gives us the opportunity to talk about how to decrease the effect on health issues due to climate changes. As we all know, if I talk about infectious diseases, all these organisms are definitely bound to show their virulence based on environmental temperature. For example, malaria, Vibrio cholera. If there is environmental change by half a degree or even less than that, their survival can be increased and the breeding of mosquitoes increases. And recently we have seen our last 17 years, dengue, which was not there during my post graduation. After that, we started seeing a lot of dengue cases due to urbanization, deforestation. And there's one more disease called scrub typhus, which happens because of deforestation due to bite of a mite. And so dengue has increased because of mosquito breeding sites have increased due to urbanization. Waterlogging has increased around the houses, and the spread of the virus through mosquitoes increases due to overcrowding and increased population. And this also has definite environmental change because we were observing that last every 4 years we see that in 1 year we have a mild case numbers and less virulent strain, and in the other year they may have high fevers and little low in platelets. The next year they may have dengue shock syndromes and admissions into ICUs. The number of cases are hugely increased, and hospitals are overburdened because of dengue cases. These are recurrent epidemics, which is not yet addressed. So this is about virulence of organism and the breeding habits based on the environmental temperature. This is regarding infections, and this can lead to hospitalizations wherein healthcare system has to use lot of disposables or lot of regular IV cats or other aspects, gloves and all. The burden of this waste material increases over the environment. Naturally, this leads to again lot of pollution, and though there are a lot of techniques where they determine bio waste, they give a lot of training to staff regarding safe disposal, and um, all these are categorized into red, yellow, blue, black bins, and staff are trained to dispose them properly so that final disposal can happen in a less polluted, to create a less polluted environment. But still, looking into so much of private hospitals coming up, overburdened healthcare system, there is a lot of chance that environmental temperatures can increase because of all this waste burden. That is one aspect. And coming to health, seasonal disease we call like dengue or any other flu or swine flu, parainfluenza. These are seasonal diseases due to low temperatures or warm temperatures or rainy season. Dengue mosquito breeds in a fresh water during, and we observe cases only during June to October or November. Cases taper by November, and later only sporadic cases are seen. This is because of rainy season. If the climate change occurs and there are the extremities of temperature, definitely you can see a huge variation in the disease burden in terms of timing and increase in burden or severity of illness. So not only the seasonal changes attributing to low temperatures and flu and high temperatures, they can cause heat waves. We have been hearing now and then in newspapers over last few years, 25 years, 50 years, there is no rain, not so much of rainfall. This was the highest, or temperatures were high. That was the highest recorded. This all is happening due to global warming and extreme weathers can themselves cause disease among the population. So this is regarding infections, then virulence of the organism, then temperature changes causing disease burden, and pollution. Naturally, utility of more petroleum products increasing due to population or luxuries, and less of other modes of transport are being utilized. Pollution has definitely gone above levels like we are seeing nowadays in Delhi or Hyderabad. We are not projecting them as an alarm as on today to public. Unless we Google it, we are getting the I mean the exact data how polluted is the environment during the season. We are getting, but we are not projecting them as alarms to the public or ourselves. So pollution can cause a lot of respiratory illnesses from upper airway to lower airway, like sinusitis, allergic rhinitis. Then that itself can cause daily headaches, discomfort in the evenings, and nasal block can cause sleeplessness and recurrent hospital visits. No exact solution unless we cut down on pollution or ask them to wear masks. There is no exact treatment for it. So they have to go through, or surgical procedures also advised sometimes for recurrent sinusitis, allergic sinusitis, as per doctors' advice they go. But this is causing the decreased quality of life, decreased work efficiency, and more work absenteeism. So this is also one cause for less productive output of the system. So simple upper airway illnesses and the asthma, recurrent wheezing, this can be life-threatening to children sometimes. If it is exaggerated, then definitely they can land up in ICUs. So nowadays we are counseling parents regarding the uh, effects of pollution, pesticides on the food products, or all outs, mosquito coils, sambrani, all these things can cause allergic tendencies to children, and pollution, and then wheezing, which, where they have to get admitted sometimes in acute cases and get treated. This leads to cost again and stress in the family environment. And acute wheezing and landscape in ICU, recurrent asthma, severe asthma can cause a life-threatening behavior. So this is one major cause for us with pollution. And definitely during COVID, we had less OP, less URI, less wheezing, no wheezing, I can say, no admissions in ICUs or wards because children were at home. This we observed for 2 seasons in COVID. And the other thing is Physical work is nowadays less. Transport system utilization has increased. Public transport also has become very less utilized by those who are affordable. So single person driving a car without carpooling, all this can lead to luxury, and this can lead to sometimes less physical exertion, can lead to obesity. Childhood obesity has increased a lot, so we should encourage them probably by having daily physical activity in terms of using less vehicular transport, where carbon can be released less. Indirectly, we can advise them. This is lead less physical activity leads to obesity and other diseases among children. Also, we are seeing more nowadays. Not only physical health, mental health. When your environment has changed, immediate environment is changing, when you are exposed to so many diseases, either to air or food or pollution, food or infections, your regular life schedule is disturbed, your healthcare burden is increased, your morbidity is increased, mortality risk is increased. This causes huge stress to the family. So the mental health of the child, because of loss of schooling, loss of a peer group company, all this indirectly affect the child. So, and also family stress. Mental health is also at stake in lot of situations. And um, malnutrition, especially below poverty line, when the environmental change is there, unseasonal rains or crops are not harvested on time, or crops are lost, that is the indirect way of decreased food production. But also the poverty can also lead to lot of malnutrition. Ill health can lead to malnutrition. The quality of life for especially below 5 children is very much affected. So malnutrition is the other extreme of obesity, and we are very much concerned because of loss of money due to health expenses or due to other causes, loss of job due to health. They all can indirectly lead to poverty and malnutrition among under 5 children. So this is the initial view of how climate can change the health scenario. And also I talked about mental health, physical and mental health diseases, malnutrition, obesity. And my work was on preventive healthcare more in terms of dengue fever. When I personally observed that there is a seasonal environment, I was always asking the authorities to look into environmental causes of changes in breeding pattern, and we have to map the place from there where these mosquitoes, Aedes mosquitoes, are causing the dengue fever and control it at early. So a lot of things, localities from where the disease pattern is coming, all this can affect us. Climate can indirectly uh, affect this pattern of diseases also. And finally, I would like to suggest, as a doctor or as a citizen, basically, I'm hearing about global warming or climate change over years. But as on today, I know very few things like to control the plastic usage, control the carbon producing petroleum, to reduce the global warming and indirectly climate change, and also seeing control your AC's utilization so that the indirect climate effect will not be affected. So these few things I know, but as a citizen, what are my basic duties? I'm not getting any alerts in daily life, or being a in profession, or there is no plan of action reaching every individual in the society. Like government has released one aspect that we have dry waste bin and wet waste bin. Where is it implemented properly? Very few societies are implementing that. Being an educated professionals in my society, I am not seeing. Once you can't dispose your dry waste and wet waste properly, I'll not able to reach the goal of stopping climate change drastically. When I compare it to the population, if I don't know, I know it, but practically it is not happening in my place. So policy making has to be very strict. We are talking about plastic ban. If one or two people stick to that, but there should be a policy change in irrespective of their personal gains in this business. There should be a policy change. So this is from government. We expect a lot to change. These are simple policy changes which may not include financial investment. It is the only notifications or alerts to be given in a more practical way. Like pulse polio, I told it's very difficult to eradicate, control COVID or dengue because of human behavior. We are not ready to accept putting a mask properly in spite of our own family getting affected if we don't follow the precautions, and our own neighbors and relatives being affected. I'll go to functions with cough, cold, and fever. So I'm not restricting. My colleagues may be affected. That is only discipline, self-discipline, or behavioral change. So before I change my behavior or self-disciplined, the policy making should come. Compulsory mask, they said. Compulsory waterlogging removal should be there to avoid dengue mosquito breeding. Singapore says that. So helmet, put on the helmet. These are all human behavior related uh, uh, imposition of fine. So to bring about this drastic change in human behavior, there should be proper guidelines to a citizen or a educated group, uneducated group, institutions, hospitals, regarding global warming, how they can control it in their own way depending on their day-to-day lifestyle. So I would definitely request this team, whoever is working towards it, to uh, to aim at an individual change. You need an proper guidelines and alert system and definite policy makers involvement. If an individual can change, then he should be taken as a volunteer and involve the family members, relatives, friends, to educate them. Then the community should be educated. Then the society. So it is coming from higher side, from policymakers and from ground level individual volunteers who can take up this issue. At least they should be given alerts to influence others by practical aspects. Schools are conducting a lot of programs for children on climate change, art exhibitions, all that. But children are exposed to so much of tinned food or packet food. Are we telling them to change their uh, acceptance of eating these tinned foods and all? How practically we are telling, but we are not showing them a practical way of implementing. So schools, education department can make wonders in changing these things. If we come forward and put pressure, then definitely these chips or biscuits will be sold in a environmental friendly packets. Though we may not stop drastically people eating these fast foods or tinned foods, we may put pressure on them if we can get through policymakers or schools. This is my suggestion, what I understand from whole thing. Thank you for so much for